Welcome back. Well, it's been a hot, sunny summer, of course, and the number of cases of melanoma in Canada as a result of sun exposure is on the rise, has been for some time. Dr. Richard Langley is a familiar face to this program. He is a Halifax dermatologist, instructor at Dalhousie School of Medicine. We're always happy to have you in, Doctor. Good to see you.
Good to see you. Thanks for having me.
It has been a hot, sunny summer, and we know those numbers are going up. Are you seeing that in your practice?
Yeah, I think we see it in our practice, and we see it in the numbers. Certainly in my practice over the last 20 years, there's been increasing rates in younger patients as well. And the statistics bear that out. If you look at the Canadian Cancer Society, it's shown there's been, over longer periods, doubling and tripling of rates of skin cancer.
And we're talking melanoma, right? Which is the most serious?
Yeah, melanoma is of the big three skin cancers we see. There's many other ones, but it's the most serious, but it's actually the least common amongst the skin cancers. Basal cell skin cancer is the most common. They don't even count the statistics for it, but it's estimated that 1 in 5 Canadians will develop a skin cancer at some point in their life, most of those being basal cell cancer, which makes it the most common cancer in Canada, skin cancer.
Is it simply too much sun exposure?
Yeah, there's several factors. Certainly sun is the dominant factor when you're talking about basal cell. But for melanoma, also sun exposure, but it's different. So chronic sun exposure, people who are fishermen, golfers, they tend to get a lot more basal cell skin cancers, 85% of them being on the head and neck, so chronic sun exposure. Whereas melanoma also has a genetic component, but it's also that it tends to be specific types of sun exposure. So a blistering sunburn has been known to increase the risk of melanoma 4-fold. And so when we think about the most common places you get a melanoma, which again is the most serious form of skin cancer, in women, we're talking about upper back and lower legs, and in men, the upper back. And so these are sites that are difficult to see. And if we look at there's differences even in skin tones, so very light-skinned people, that would be true. In darker skin tone people, we may see more of them on the feet, for example. And Bob Marley died of a melanoma. Many people don't know that. So all skin types can get skin cancer.
I want to pick up on something. You mentioned young people. Those numbers are increasing in?
Yeah.
Is the message about covering up and sunscreen just falling on deaf ears? Have we become complacent?
There are some statistics in Canada, and actually in Atlantic Canada in particular, to show that there has been some fatigue about it, and I think that there's often fluctuations in how often people are doing this. But even when we're at our very best, it's very rare for people to have. Most people to have sunscreen on or to be using sun protective behaviors, because it's not just sunscreen. You could be using broad brim hats. You could be avoiding peak sun hours like 10 to 3. I think that we've got a long way to go, and the increasing rates are partially related to that. But they're also partially related to the fact we're just getting better at diagnosing melanoma. People are coming in earlier, so we're seeing more cases that are early. And that will make the numbers go up as well.
Reapplying sunscreen, always important. I'm like a broken record at my house on that one. Okay, on diagnosis, it's important that people keep an eye on themselves, right? It's hard to get in to see someone like you, especially in the Maritimes, to see a specialist, to see a dermatologist. Is it a matter of, just staying with the GP and saying, I want to get a thorough check, and because you need to be referred to someone like you, and it can be, what, a year sometimes? Sure.
So I guess just to step back for a second, the first important point you mentioned is the diagnosis, and I think people may not patients are very good at diagnosing their own skin cancers. Statistics have shown 50%, at least 50%, are self-diagnosed by patients. Now, interestingly, in the past, the majority of those have been women. So women tend to be better and probably, more diligent about examining their skin from some of the research. So that's the first thing, is that you need to be examining. I mean, how many people know what's on their back right now? How many people are looking? So you may need a partner to help you, or you may need to use a mirror with another mirror kind of to be able to look, and there are ways of doing it. So self-detection is critical, early detection, because if you diagnose skin cancer early, it's curable. It's the more advanced ones when it's left to grow undetected when it can spread. So I guess that to me is the big part. The second part you mentioned, which is about how to get in to see a dermatologist, I still believe that the foundation should be with the primary care system. So family doctors, we're expanding it now to nurse practitioners, physician assistants. So and these folks are being trained to diagnose skin cancer, but it's not perfect.
And almost impossible if you're doing virtually, right?
Right, and so they're not perfect, neither are we. Certainly dermatologists who use special techniques and technology can be, but the point is, I think that most of them can be diagnosed with routine exam, either self-detected or at that level. Now, you made a good point. It can be a year to get into CS. But we also triage. And if you go on the website for Dalhousie Medical School and Dermatology, it will show that there are target times to be seen. And if you are thought to have a melanoma, the triage period is short, measured usually in like a week, or perhaps it might, depending on which type of skin cancer, it might be a month, but it's shorter. And so the key thing is that it's important when there's a suspicion of a skin cancer that gets communicated to the referring physician. And if it is, we will do our best to get people in. And the patients should persevere. If they're worried, don't just sit at home. Let us know, because we do want to see the patients. We want to see all the dermatology concerns, but the skin cancers, in particular melanoma, they are at the top of the list.
Great information. Always good to have you in. Thank you very much.
Pleasure.
Have a great summer. Golf in the mornings and in the late afternoons, not midday.
Try to get the early tea times and look at the UV index.
Okay, very important. Dr. Richard Langley, thank you very much. All right, we'll take a short break. We'll be back with much more of your local news. Don't go away.